Today we will discuss the surface marking of the abdomen. What is surface marking? What is the meaning of surface marking? So what is surface marking? What do you mean by surface marking? Anything means any blood cell, RBC, WBC, platelet, that is also present in our organs and vessels, bones. In short, it is the surface projection of the anatomical structures of the body over the body surface. Anatomical structures means it might be an organ like liver, spleen, stomach, any blood vessel like superior mesenteric artery, origin of superior mesenteric artery, origin of celiac axis, any opening like ileocecal valve, opening of the appendicular orifice, opening of the cardiac orifice, opening of pyloric orifice, the root of the mesentery. So, and we might be doing any surface projection of any artery, any vein, any nerve, okay. So, there are many things which can be projected in the surface, body surface, especially in the abdomen. But first of all, we must have some idea about the planes. There are three major planes in the abdomen by which we can divide the abdomen into different quadrants. The first one is the right or left lateral planes or the mid-clavicular lines. You can have an idea that is clavicle and midpoint of the clavicle. Through the midpoint of the clavicle, we can draw one line downwards. That line is continued below and it's passing through the midpoint of the inguinal ligament, mid-inguinal point. So, we can get two planes or two lines, that is right and left lateral planes. Now we can get another plane because we can imagine there is GP sternum, and if I place the hand just below the GP sternum, the hand should be of the same person, not like mine. If we place one hand and if we go below the one hand breadth below, we can make a plane, we can make a line. That line is called transtubercular plane, which we can see it here. आगे एक तो चले ना, आगे स्लाइड एक तो तुम्हारे transtubercular एक तो दाबिन चलो ना. Transpyloric plane, sorry. Here we can find ওইটা আগেরটা দেখো আগের স্লাইডটা দেখো Here we can find this plane which is one hand below this GP sternum. So this is called the transpyloric plane. Before that I told you about the right or left lateral planes, or the planes are passing through the midpoint of the clavicle and midpoint of the inguinal ligament. So mid-clavicular, this same plane is called mid-clavicular plane, and this one is called the transpyloric plane. That is transpyloric plane. Another plane we can draw. This is called transtubercular plane. How we can draw it? We know there is anterior superior iliac spine, we can feel. Anterior superior iliac spine in the hip bone. This is the anterior superior iliac spine. So, in a living body, we can feel the anterior superior iliac spine. And when we can reach the anterior iliac spine, we have to go along the iliac crest. Along the iliac crest. And we will, how much? We have to move? We have to move only for 5 centimeters, that means 2 inches. And there we will get a tubercle which is called iliac tubercle. So the plane is passing through this iliac tubercle, and this plane is called the transtubercular plane. So by this we can divide the abdomen into different quadrants. Look, this is transpyloric. Okay, আগের ছবিটা দাও, আগের ছবিটা হবে, বেটার আছে। Here is the transpyloric, transtubercular, and right and left lateral planes. So we can get so many quadrants now. This is epigastrium, this is hypogastrium, this is left hypogastrium, this is around the umbilicus, so umbilical, this is right and left lumbar, this is hypogastrium, and right and left iliac fossa. So there are 3 major planes. Now we will come to the different points. There are so many points in the abdomen, but as per your syllabus or NMC curriculum, 10 points are important. These 10 points: 1, origin of celiac artery or superior mesenteric artery, cardiac orifice, pyloric orifice, tip of the 9th costal cartilage, fundus of the gallbladder, base of the appendix, McBurney's point, duodenojejunal flexure, and 4th, lumbar vertebra. Now we will try to discover the first one is, tell me the first point. Origin of celiac trunk. For that we have to draw the transpyloric plane. This is the transpyloric plane. Why it is called transpyloric plane? Here we will get the pylorus of the stomach. There are two ends, one is cardiac end, one is pyloric end. So we can get the pylorus. And also in this plane we will get the hyla of both kidneys. And then on this plane we will get fundus of the gallbladder. So many things we can get. And there are so many structures are related to this plane. Now origin of celiac axis. It is 1.5 centimeter. That means just more than half inches, above this plane and in the midline. Here we can get that point. So this point is 1.5 centimeter just above the transpyloric plane in the midline. That is the origin of celiac trunk or celiac axis. When we will draw this point, your examiner will ask, what are the different branches of celiac axis? I am not going into the detail. Okay. What is the level? Where you will get it? Okay. So that is, you must have those ideas when, that is the celiac axis is T12 level at the 12th thoracic vertebra level, just below at the lower border of the T12 vertebra. And there are three branches: left gastric, splenic and common hepatic. Okay. And what is the breadth? You should have that idea. 1.25 centimeters. So that is the origin of, this is the swab stick. You have to put a point here like this. Now the next point is most probably, that is origin of superior mesenteric artery. Just below the transpyloric plane. Okay, almost at the midline. So that is the origin of superior mesenteric artery. Superior mesenteric artery is the artery of foregut, midgut, hindgut. What are the branches? There are some branches coming from the concave surface, from the convex surface and from the anterior surface. From the anterior surface you are getting middle colic. From the concave surface you are getting ileocolic and right colic. And also you will get, there are superior pancreaticoduodenal from celiac and inferior pancreaticoduodenal. And from the convex surface you will get the branches to the jejunum and ileum. The next point, cardiac orifice. How we will draw it? Cardiac orifice of stomach. Cardiac orifice of the stomach remains at the level of 7th costal cartilage. So we have to count the rib. To achieve that point, we have to count the rib. We know this is the 2nd, 3rd, 4th, 5th, 6th, 7th. I can feel the 7th costal cartilage here. How we can come? 2nd, 3rd, 4th, 5th, 6th, 7th. 7th. It remains over the 7th costal cartilage. And how much away from the midline? Only it is 2.5 centimeter away from the midline. So it is coming at this level. So in the living body, we can find 2nd, 3rd, 4th, 5th, 6th, 7th. So this is the 7th. One and this point is at the level of 7th costal cartilage, 2.5 centimeter, that means 1 inch away from the midline. So this should be the point. So the point is at the level of 7th costal cartilage, 1 inch away from the midline. And how we will draw it? First we have to put a point like this, and around the point we will give 2 lines. That lines are around 2 centimeter apart from each other. So this is the cardiac orifice. Next is, I think, pyloric orifice, 4th point. 4th point is pyloric orifice. That means it is definitely over the transpyloric plane. Pyloric, transpyloric. How much? It is half inch to the right of the midline, and it is over the transpyloric plane. Okay. And how we will draw it? We will draw it. We know again there are 2 lines, parallel lines we can make. We can make 2 parallel lines around it. So that is pyloric orifice. And if I can join these 2 with a curved line, if I join these 2, then I can make out the lesser curvature. I will come later. Next is the tip of the 9th costal cartilage. Tip of the 9th costal cartilage you can feel in your body. You can feel it in your body. Just taut your anterior abdominal wall. You can feel the rectus abdominis muscle. You can feel the lateral border of the rectus abdominis muscle. And if you go upwards up to the costal margin, here I can feel the rectus abdominis muscle. and this is the rectus abdominis muscle of the left side, this is the rectus abdominis of the right side. I can feel the lateral border of the rectus abdominis, linea semicircularis. Okay, and we can feel, and I can also feel the costal margin, right costal margin. The junction between the right costal margin and the rectus abdominis muscle, the right border of the rectus abdominis muscle, this is the point. Here we can feel the tip of the ninth costal cartilage. Here we can put a point. Here I can put a point. So this is, here we can feel the tip of the ninth costal cartilage. Now what is the importance of knowing this one? The junction between the right costal margin and the right border of the rectus abdominis muscle, right rectus abdominis muscle, because at this point we get the fundus of the gallbladder in acute cholecystitis, that means in inflammation of the gallbladder, acute inflammation of the gallbladder. If we press a little, there will be tenderness. The patient will complain, he or she is getting pain. So this is this ninth costal cartilage, and this is also the point of fundus of the gallbladder. So number 6 is already been covered. Okay. That means the fundus of the gallbladder is the same point, the tip of the ninth costal cartilage. Okay. The next is the base of the appendix. Before that, we have to draw right mid-clavicular line or right mid-inguinal line. If I feel this one, this is the clavicle, the midpoint is here. If I draw it, then we can go down. I can go down. Yes, I can go down. This is the right mid-clavicular line. This is right mid-clavicular line, and I can feel the tubercle, iliac tubercle, and through that iliac tubercle, if I draw another line, which is the transtubercular line or transtubercular plane. So this junction between the right mid-clavicular line and transtubercular plane, this is one point. This point, that the intersection of transtubercular plane and the right clavicular line, this point is nothing but the opening of the ileocecal valve. So this is nothing but the ileocecal valve. So this is the ileocecal valve. If we can go 2 centimeter below the ileocecal valve, 2 centimeters means like this. So this is the opening of the appendicular orifice. So first we have to draw the right mid-clavicular line. Then we have to draw the transtubercular line. The intersection point is the that is the opening of the ileocecal valve, and if we go 2 centimeters below, this is the point, this is the opening of the appendicular orifice. But during appendicitis, you will not get pain here. It will first originate around the umbilicus. Then it will move towards the right iliac fossa. Then which one is the most tendermost point of appendicitis? That is called Mag-Barnes point. Number 8. How we will draw it? We have to draw a line joining this anterior superior iliac spine and the umbilicus. So this is the anterior superior iliac spine. I can feel it here, and this is the umbilicus. I will join these 2 points with a line which is called spino-umbilical line. Spino-umbilical line means anterior superior iliac spine and the umbilicus. If we go if I divide this line into medial 2/3 and lateral 1/3, the junction between medial 2/3 and lateral 1/3, we can put a point there, and that point is nothing but Mag-Barnes point. So Mag-Barnes point is the point of maximum tenderness in case of appendicitis. Appendicitis means inflammation of the appendix. What is appendix? It is a rudimentary, that is bud, an organ. It gets inflamed many a times due to several factors, and we will get the point of maximum tenderness at the Mag-Barnes point. How we will draw it? We will join the anterior superior iliac spine and the umbilicus, and we have to search the junction between medial 2/3 and lateral 1/3 of the line, and that point is the Mag-Barnes point. Next is duodenojejunal flexion. Duodenojejunal flexion. That means we know that duodenum becomes jejunum. So there is a flexion. The C-shaped duodenum, it becomes jejunum. So there is a flexion. Duodenojejunal flexion. How we can draw it? First, I have to draw the transpyloric plane again. The transpyloric plane or transpyloric line. Okay. It is 1 centimeter below and 2.5 centimeter to the left, 1 centimeter below and 2.5 centimeter to the left of the transpyloric plane. Okay, so this is the point. This represents the duodenojejunal flexure, which is been represented by two curved lines. Two curved lines which shows the duodenojejunal flexion. Okay. Now, if I join this duodenojejunal flexure and the ileocecal valve, we can draw a line if but just joining these 2 points. We can get a curved line. This is nothing but the root of the mesentery. First, we have to know that duodenojejunal flexure and we have to know the ileocecal orifice. And if we join these two, we will get the root of the mesentery. Forget it. Now the fourth, lumbar spine. It is from the back. We have to search for the highest point of the iliac crest. Okay. Highest point of the iliac crest we have to search. And through that we have to draw one line. Which is called transcrestal plane. We have to feel the highest point on the iliac crest. That means this is the point. And through that point, if we go behind, then we can reach the tip of the fourth lumbar spine. So this line will intersect behind with the vertebra, and here we will get the fourth lumbar spine. So this transcrestal plane is at the level of fourth lumbar spine. What is the importance of knowing fourth lumbar spine? Spinal cord ends at lower border of L1. Then we will get L2, L3 and L4 vertebra. Generally, the L1 and L2 space is avoided. L3 and L4 space is suitable for lumbar puncture. We have to collect the cerebrospinal fluid from the back, and we have to negotiate in between, generally this space between L3 and L4 vertebra. So anesthetists, they are very much interested about knowing this L4 vertebra, because the space between the L3 and L4 is the suitable place for insertion of the lumbar puncture needle. Okay, so that is the tip of the L4 spine. Next is the inferior border of the liver. The points are already been covered. Already you know. The first point is at the cardiac apex. That means it is at this level. That means it is in the fifth intercostal space, 9 centimeter away from the midline, at the level of nipple. One point should be given here, just below the nipple. One point is given here. this is the transpyloric plane. The first point is given at the cardiac apex. You can see the cardiac apex. This is the cardiac apex. Now I am drawing this transpyloric plane. The next point is at the midline at the transpyloric plane. The third point is at the tip of the ninth costal cartilage. That means the junction between the right border of the rectus and the right costal margin. The third point. And the fourth point, we can feel the tip of the 10th costal cartilage. It is very much prominent. If we can feel it, this one, we can feel it in our body. Here we can feel it. I can feel it here. So that is another point. So point 1, point 2, point 3 and point 4. If we join it, this becomes the inferior border of the liver. Now what is the importance of inferior border of the liver? The inferior border of the liver is palpable in a child below 3 years of age. Liver can be palpated normally. Normally the inferior border of the liver can be palpated. Palpated means I can feel the lower border. In a normal child below the age of 3 years, beyond which it will go inside the thoracic cage. So we cannot feel it. But in case of hepatomegaly, we can feel the lower border of the liver. So this is the lower border of the liver. Next, fundus of the stomach. We have to draw this, we have to point the cardiac orifice. That is where we are getting the cardiac orifice? On the 7th costal cartilage, 1 inch to the left of the midline. So that is the cardiac orifice. The next point is the apex of the heart, that is the 5th intercostal space, 9 centimeter away from the midline, just below the nipple. And we have to draw these two lines with a curved line. So if I can join these two lines, 2 points, that means the cardiac orifice and the cardiac that means the apex, with a curved line we can draw this fundus of the stomach. So fundus of the stomach can reach up to the fifth intercostal space. That means at the apex of the heart. So it is apex of the heart is related with fundus of the stomach, and the fundus of the stomach contains gas, fundic gas. So after heavy meal, what will happen? Accumulation of the fundic gases, and it will push the heart, and there will be palpitation. Okay, so this is the fundus of the stomach. Next, lesser curvature of the stomach. This is cardiac orifice, and this is pyloric orifice. Just join this cardiac orifice and the pyloric orifice with a curved line. We will get the fundus, greater curvature of the lesser curvature of the stomach. Lesser curvature of the stomach is related to what? There is anastomosis between two important arteries. Around the greater curvature there is one anastomosis, and around the lesser curvature there is another anastomosis. Anastomosis of along the lesser curvature, just tell me. Yes. Please explain it in English, okay? Because there are so many students, they don't know the Bengali, okay? So there is anastomosis between right gastric and the left gastric artery. And there is a notch which is called, there is one notch, incisura angularis. Incisura angularis. And along the greater curvature and the lesser curvature, in which curvature you will get the development of peptic ulceration. Yes, this is the lesser curvature where you will get the incidence of peptic ulceration. There are several points. Okay. Next is root of the mesentery. Root of the mesentery, I have already shown you. The junction between the, this is the ileocecal orifice, and this is the duodenojejunal flexure. This is the duodenojejunal flexure, and this is the ileocecal orifice. And if we join these two lines, 2 points with a curved line, that is the root of the mesentery. The mesentery. What is mesentery? Fold of peritoneum by which the viscera is held to the posterior abdominal wall. Here the small intestine. So along the root we will get the continuation of the superior mesenteric artery. We will get the branches from the convex side and from the concave side. From the convex side we will get the jejunal and ileal branches, and from the concave side we will get right colic, ileocolic, and inferior pancreatico-duodenal branch. And from anteriorly, we will get the middle colic. Next is the kidney from the back. You can see there are two lines which are drawn in the back. This is the fourth lumbar spine. This is the third lumbar spine. Okay. So we have to put a point over the third lumbar spine. Then second, first, T12 and T11. This is the T11. So we have to point, we have to give 2 points at the level of T11, vertebra at the spine of T11, and we have to put another point at the level of tip of the third lumbar spine. We have to draw two lines, two parallel lines. Around this T11 and L3 vertebra, and we will draw another two parallel lines. One line is 1 inch away from the midline, and another line is 4 inches away from the midline. We will get a parallelogram. We will get a parallelogram. That parallelogram is called Morris parallelogram. And within that Morris parallelogram, we can draw the kidney. You can see the upper pole is nearer to the midline, whereas the lower pole is away from the midline. Upper pole is 1 inch away from the midline, and whereas the lower pole is 3 inches away from the midline. So it is placed obliquely. Okay. So this is called kidney from the back. So kidney from the back is drawn inside this Morris parallelogram. Okay. Here you can draw it. How you can draw it? Like this, you can draw it. So, what is the importance of this Morris parallelogram? Kidney is dissected, approached from the back. What is the surgical anatomy of the kidney? Nephrectomy. Removal of the kidney, partial or full. There is one tumor which is called Wilms tumor. Wilms tumor or renal cell carcinoma. We can reach the kidney from the back. So, in that case, we have to know the surface projection of the kidney. So, you just remember there are 3 planes, 10 points and 5 lines. That much. Okay. You can practice it in this body. You can practice it. Those who are interested, please practice it in this body.